Hey fam, I am in my office today, which is just being home at my desk, and wanted to talk to you all about differential diagnosis and the importance of making sure that you yourself, as you're, considering your symptoms and seeing your doctor about whatever your symptoms are, really get to know your neurodiversity. It is a spectrum, and so it's likely that, most people are on the spectrum somewhere. And when I say neurodiverse, I am talking about ADHD, autism, and a highly sensitive person. And then there's all kinds of other qualifiers like sensory processing disorder and all just different kinds of things that people can experience in their neurodiversity that often get misdiagnosed as um, depression, anxiety, which people can experience depression and anxiety, of course, if they, with or without neurodiversity. But what brought this up for me today was that I have a client who's been treated with a pretty heavy psychotropic for cyclothymia. Which is like a milder version of bipolar because they had undiagnosed autism, and even just knowing this person a little bit and like getting clear on their experience in life, is just become very obvious that they are on the spectrum. And it's likely that this significant medication has caused them a lot of distress and unnecessary symptoms of physical symptoms, medical symptoms. If their doctor had done a differential diagnosis, meaning had asked them, what other symptoms are you having? When do you experience this anxiety and depression? What's going on underneath the surface? This is the importance of therapy too. But it is just unfortunate that our system does not seem to be built yet to help people get really clear on what might be causing their anxiety and depression, because if it is some neurodiversity, then let's treat that. And a lot of times just naming the neurodiversity, someone, gaining insight into their autism symptoms and normalizing that for them helps them to feel relieved from the anxiety and depression, because a lot of that comes on from pressuring ourselves to be neurotypical when we're actually neurodiverse. And so there's lots of free tests online that you can take, and I would encourage you to do that. Just type in, free test for ADHD and neurodiversity. Look up highly sensitive person. You can self-test and, gain clarity there.